artery, what we're going to do is you're going to take 3 fingers and use light pressure and just feel in this area, caudal to the lateral canthus of the left eye. So just right here. And you're going to gently stroke this area with these fingertips, looking for the artery. And and then you're going to discern the pulse, counting for 10 to 15 seconds. And depending on whether you count for 10 seconds or 15 seconds, you're going to multiply that number that you get by 6 or 4. So that's the transverse facial artery. And that multiplication will help you find the pulse rate for a minute. So now we're going to find the facial artery. So the facial artery is, so you're going to need to run your fingers along the ventral margin of the mandible and find this artery running perpendicular to the mid-mandible. So you're going to stabilize it with your index and ring finger right here. And then you're going to read the pulse or feel it gently with your middle finger right here. And you're going to do that over the medial edge of the ventral mandible right here. And the next thing that we're going to look at is our submandibular lymph nodes. So, slightly caudal to where we just found our facial artery, we're going to place fingertips of both hands at the midline of the external intermandibular space. So right here, in this area right here. And you're going to press up gently to the root of the tongue, to the ventrum of the root of the tongue. And you're also going to slide a set of fingers to the medial surface of each mandible. So kind of like this sort of motion. And you're also going to gently push one set of fingers up dorsally. That will displace the intermandibular tissues laterally, and that will eventually displace one of the submandibular lymph node of the opposite side, so the contralateral submandibular lymph node. And you can just keep doing this as much as you need to assess those lymph nodes. The next thing that we're going to look at is our retropharyngeal lymph node. All right, so we're going to locate the retropharyngeal lymph nodes, and so what we're going to do is we're going to place both hands over the dorsolateral aspect of the larynx, and then we're just going to move our hands ventrally over the larynx and then reset our hands back to where we were, and then we're going to move our hands rostrally over to the intermandibular space at the angle of the mandibles, and just look for these paired lymph nodes. And if they're enlarged, you're going to have a problem, but if not, you're fine. So you won't feel them if they're not enlarged. Okay, so I'm going to run my hand. So I'm going to look for the parotid lymph node now, and I'm going to just run my hand up towards the ear, but I'm making sure that I'm starting like close to where the caudal to the ramus of the mandible. So I'm moving my hand up from there and feeling for that parotid lymph node. And normally in this area I would just feel tendons and like musculature, but if I was to feel the parotid lymph node, then that would be a sign that there's something going on with this horse.